Okay, so today I'm going to tell you the difference between OCD and OCPD, obsessive compulsive personality disorder. So basically what happened OCD, first of all I'm going to talk about the OCD. It is the meaning of OCD is obsessive compulsive disorder. This happened just because there is a dysregulation in the serotogenic system. That means there is a reduction in the serotonin between the synapses. Why this happen? It can happen due to genetics. It can happen due to stress related things, like if the patient is in the stress from the long period of the time. So that can happen due to the that can induce OCD. In OCD there is two things: obsession and compulsion. In obsession the patient will have intrusive thoughts, thoughts again and again, again and again, again and again. The patient cannot remove the thoughts from the mind, and the patient will feel develop a cycle of thoughts. So that's why it is known as the obsession. Or the patient can have distressing thoughts, if the patient will start thinking that the thoughts can cause distress in the life of the patient. Like, if I do this, this will happen with my life. If I do this, this will happen, do this in my life. So this is called obsession. And if I talk about the compulsion, compulsion happen mean repetitive behavior of the patient. Like when the patient can wash hand again and again, the patient will wear check the, like if I have closed the electricity button again and again, they will check the like I have closed the gas on or not. So that's why this is known as the obsession. But in case of the obsessive personality disorder, the patient will have uh, this can why this how this can happen. This can happen just because of the genetics, just because of the environmental, or just because of the lifestyle from the childhood. So in the obsessive compulsive personality disorder, the patient will have like perfectionism. The patient want to do everything with perfectionism. The patient have rigidity of thoughts, that mean a thoughts that cannot be changed. If a patient have some kind of thoughts in the mind, like if you try to change, the patient cannot change the thought. Like, I want this thing to be like this, I want it like this, nobody can change that. The patient will have extreme rules and regulation in the life. I want to sit like that, I want to wear like that, I want to walk like that, I want to talk like that. So this is known as the obsessive compulsive personality disorder. And what happened, how you can treat both of the condition in OCD or OCPD. So OCD and OCPD are treated with the same kind of a drug. You have to give antidepressant. You can give selective serotonin reuptake inhibitors like fluoxetine, paroxetine, FLOUXAMINE, citalopram. Every drug dose start from the 10 milligram, and it can goes to the 20 milligram or more depending upon the patient or the weight of the patient. When you will try to give the selective serotonin reuptake inhibitor in both the condition OCD, OCPD, obsessive compulsive disorder, obsessive compulsive personality disorder. So when you give SSRI, the patient will have increment in the selective serotonin between the synapses, due to which the patient condition or the symptoms can be manageable. Or you can also give tricyclic antidepressant like the clomipramine. Yeah, this is clomipramine is a drug, that is the TCA. Or you can also give the cognitive behavior therapy. That mean in OCD, if the patient have fear from the contamination, you like from the dust, so you will put dust on the hand of the patient in every sitting. So the patient will get the neurology, the neurons what we say plasticity of the neurons changes. Like if I have a dust in my mind, that's fine, to be honest. I don't have any problem with that. And in case of the OCPD, how you can change the plasticity of the neuron, you can change, like if the patient want everything to be done in a perfect way, we will ask question, why you want this to be in perfect way, why you want to do the things like that, what will happen if you don't do this in a perfect way, why you cannot change your thoughts again and again. So that's why we ask the question, and we will try to change the the plasticity of the neuron. So that's why the patient can feel relaxation, or we can remove the condition from the patient mind. Yeah, so this is the OCD and OCPD. In OCD, we have ego dystonic. That means the patient will try to change the thoughts with a frequent period of the time. But in case of the OCPD, we have ego syntonic. That means the patient cannot change anything. The patient consider it as a relation with the